Hi, everybody. Happy Friday. I'm gonna wait a minute to make sure that we are working this Friday because I know on Monday we had some technical difficulties. So let me see if we are good to go. Yep, we are. Okay. Hi, everybody. Happy Friday. We are here at the end of clinic at DS Family Medicine. So happy to be with you. Hey, guys. So today I wanted to kind of go old school and talk about a specific nutrient that our body uses that seems to be a hot topic right now from what I am told on TikTok. And so actually some of the staff here asked that I talk about it today and kind of give more of a medical kind of education on the topic of this specific thing, so we could kind of let you know how we do things over here, and not so much in the TikTok world, but I thought it was really cute. So from what I am told, there are a ton of new TikTok videos about the a building block for protein synthesis, not necessarily an essential nutrient like chromium that we talked about last time, but something called L-tyrosine is becoming a big du jour thing to talk about, because a lot of people are saying that it is giving them benefits, specifically in place of possible ADD medications, stimulant medications, antidepressants, and treats things for like depression, narcolepsy, these things. If you have or suffer from one of those things or have one of those diagnoses or have ever had treatment, you know that some of the medications can be quite frustrating because those pharmaceuticals are really approved when they work 30% in the studies. 30% is not that great, right? And come with a lot of side effects and problems. And a lot of times when we prescribe medications for psychiatric concerns, complaints, diagnoses, it's kind of like, hey, check the boxes. Okay, you qualify this, try this, call me in 4 weeks. And that can become a very frustrating cycle for the patient. So here, especially because I have a degree in neuropsychology. I did that before medical school. I'm very passionate about giving patients tools to understand how their body and their brain works, to better work with their body and understand why they may have certain challenges mentally, physically, emotionally, that are different from the next person. And so we like to explore those and help you support the way your body is naturally able to function before we necessarily give you a medicine. Or if we give you a medication, we want to give you all the tools to assure that that medication is going to work as good as it could, should, would in your body with as least amount of side effects as possible. So with regard to the question of the week, which was L-tyrosine, it is a building block for protein synthesis, not necessarily an essential nutrient by itself. And it's a precursor for neurotransmitters in our brain, specifically dopamine, norepinephrine, and epinephrine. So these are neurotransmitters, or communicators that our brain fires that help us really interact with the world, right? So these things are particularly important when we face stress, acute stress. So in times, even if you have normal neurotransmitter levels at a baseline, there are times in life, I'm sure specifically in the past year, everyone can attest to that, where you would use up these neurotransmitters faster than usual, and then your body would theoretically require extra tyrosine to keep these levels up in your brain. So that is the thought behind using a supplement like L-tyrosine to support the body and the brain to kind of function better with regard to these neurotransmitters that help us deal with acute stress situations. Certainly, if you're depleted of those things, then you're going to have a different threshold of capabilities, a different reserve, so to speak, for the next thing that happens, right? So these, particularly supplementing with these things can often be not necessarily something that you do every day, but maybe that you do in conjunction with just knowing, okay, I'm really feeling run down today. I'm really feeling tired. My brain's kind of foggy, not working. What are things I could do to boost these neurotransmitters in our brain? So it's definitely known that the L-tyrosine supplementation can actually even help thyroxine, which is a thyroid, one of our thyroid hormones. So it can definitely do a ton of great things in the body, particularly in the brain. And I know that's probably why there's a bunch of talk about it on TikTok. And specifically, it's definitely been researched and proven to help in certain studies with depression, narcolepsy, acute stress, and even cocaine addiction, which is pretty cool. On the other hand, something that I think is not talked about as much is that it's not an essential nutrient. So you actually need this tyrosine, the level of tyrosine in your body depends on phenylalanine. So it's directly related to those two things. And you actually need both of those things to have optimal levels in the brain. So oftentimes just taking L-tyrosine is not going to be the whole picture, right? So the supplement we have here, actually called Dopa Boost, this is our Dopa Boost, has both in it at a significant milligram that we have found it definitely helps a lot of our patients. We have a lot of patients come in here who want to get off of medications, use a supplement instead. We have a lot of tools that I'm about to talk about to help them figure out how to best do that. But with regard to actual L-tyrosine, we like to give it in a dual form for most of our patients where they're getting the phenylalanine and the L-tyrosine together at the same time in conjunction. As you increase one, your body needs the other, right? So if you give them together, you're really supporting that whole train of, that whole cascade of synthesis for those neurotransmitters that we said were so important, particularly in stress. So that is our Dopa support. We love it. The other thing to know is that L-tyrosine actually competes to cross the blood-brain barrier with other proteins. So you don't necessarily want to take that supplement with a very high protein meal. And in fact, if you take it with high carbohydrates, you actually increase its absorption through the blood-brain barrier. So you can get even a better effect if you actually take it with carbs. Now, you all know I'm not talking about donuts, but just to know, if you're taking a supplement and sometimes it's not working, oftentimes it's because nutritionally you're not doing the things to optimize the absorption and utilization in the tissues of the body, and particularly getting it across that blood-brain barrier to even have an effect. So insulin and carbohydrates all help tyrosine to work better and help your brain to work better. Believe it or not, I know we're not all about, not talking about candy. We're talking about the good whole eating and whole carbs. So the other thing I'd like to tell you is that we love to think that it's as easy as stop your medication, take tyrosine, and it's a happy world. We all know that's not necessarily the truth, but we have other ways to figure out what could help you. I certainly don't like the idea of when you're using pharmaceuticals, especially psychiatric medications, you don't want to necessarily, for all the reasons I just told you, start taking supplements that also boost or add to neurotransmitter levels. So I think that's very important to know, and I often see that done, and it's concerning for some patients because you're taking a big supplement that's affecting transmitters, and then you're actually using a pharmaceutical that's sitting on receptor sites of those transmitters. So we truly don't know exactly what's happening there, and at some point you can easily be giving the brain mixed signals, is what we call it. And so you really want to know why you're doing something for what reason. Now, if you're trying to wean off a pharmaceutical, sometimes it's a beautiful thing to then be able to add the supplement as you wean off. But I would just caution combining a bunch of things with supplements and pharmaceuticals, specifically with medications that are made for depression, anxiety, and things like that, because often you can kind of create a little bit of a mess there and not know what's what. So just know the pharmaceuticals are done, those trials are done not in conjunction with things like L-tyrosine, which actually change the levels, the baseline levels to begin with. So, but it's a beautiful thing, and yes, we have had a good amount of success getting patients off of medications and using those types of supplements, and it's really fun when you can do that. The other way that we help our patients understand their bodies and to understand where to even go with those supplements above and beyond symptoms or diagnosis is really to understand how you're made, and that's what we love to do here. And so we have two ways that we can further explore. Would you always need L-tyrosine? Would you always need Dopa support? Do your dopamine receptors have a higher tendency to not work as well? And so one way we do that, of course, is with our DNA mind test. So this test has really become a hallmark of the way we practice here with regard to psychiatric help of our patients and kind of exploring their concerns and their symptoms.
And particularly, our mind test really looks at neurodegenerative disorders, mood, and addictive behaviors. So, of course, with that, and this is, I don't know how much you can see, but we would like to just go look at this summary that gives us an idea. Right down here is dopamine receptors, and then right here is neurotropic. So this patient has all neurotropic variations and some of dopamine, so it is likely that maybe he, or whoever this was, could actually benefit from L-tyrosine that would push these neurotransmitters up that are at baseline, maybe don't function as well as they could, should, or would otherwise. And so we love having that because this is how you're made. And so we're not going to change this about you, but we can do things that increase the expression of those genes that can kind of counterbalance this. Another thing that actually increases expression of your nootropic hormones is exercise. So of course, combining all of the approaches, a little bit of a supplement, some good nutrition, things that increase dopamine would be bananas, even coffee, coca, things like that. And then some good exercise. And yes, sometimes you can do a little bit of a couple of things, but the downstream effect of that is great. And so that is something that we love to help you do here is take the next step in front of you and do all those things to help you feel better without hopefully having to use a ton of pharmaceuticals that have interactions and side effects and all those things. But certainly if you need them, we're here to do that too, and kind of explore all the options. The other thing that we have in kind of our complete triad of ways we look at brain stuff is our neurotransmitter test. And so it's often very cool. We have someone come in and they say either, I've had depression for a long time, or I've been on this ADD medicine forever. I really want to stop taking it. What are my options? Well, we can explore that by doing the DNA test to see, hey, genetically, how is their brain made? Let's work with it. Let's know what we're working with at a base. And then look at things that can boost those levels. At the same time, we can do a neurotransmitter test, which is a take-home urine test. It's very cool. And we can actually get levels of the things that we know we're interested in. So you can get a level of L-tyrosine and see, is that even your issue? Where along the whole protein synthesis pathway could we boost and intervene to really have great downstream effects? So we love using diagnostics like that to explore reasons why to do something, reasons why we might feel the way we feel, or have the brain fog or decreased brain function, and how we can get it back and how we can move forward and help you in your health journey. So I hope that was helpful. That was our little TikTok, up it to the next level talk. So I hope that the staff who, gave me the idea thinks that this is a good way to talk about it. Of course, we want to explore a little bit more. We would love for everyone to be able to just take some L-tyrosine and it to be a great thing for everybody all the time, but it's oftentimes not that simple, but it's oftentimes not as complicated as a ton of medications, and you really don't know what's what. You don't know what's a side effect, what's helping you, what's not, and sometimes you're often just more frustrated than you were before you even started. So we love to explore things with you here and give you all kinds of options. Like I say, 5 right ways to do any one thing. And explore what other things you could do to support your brain, support your health, and support your overall mind-body balance, because that is such a beautiful thing. Hard to find these days, but we are here to help you do it. So we want to, for the rest of this month, definitely give you 10% off of our DNA Mind test and our neurotransmitter test for anybody who's interested in doing that. It's super fun and easy to do. No blood work. Their neurotransmitters a take home, and our DNA Mind test is just a saliva test. So we do a lot of those. It's fun to explore things. We're always able to find out some great information about how the patient is made, which truly can be therapeutic in and of itself to understand your body, understand your brain, and know how to work with your body and further along your health journey and put the health back in care and back in your mind rather than kind of just throwing a medicine at you that really got approved because it worked 30%. On the other hand, if you are on a medicine for anxiety, depression, and you get wonderful benefits from it, please consider yourself blessed, because some people do not. And so don't bang yourself up about it. You can still do the test. And sometimes at the end of the day, the test supports the fact that
you have been on your Lexapro for 10 years and it works well for you. And so that's a wonderful thing that you can get a benefit from a medication without getting a bunch of side effects. And it can, we have beautiful options that have been around a long time. They're not super scary. And when they work for a patient and kind of help them live a better quality of life, well, that is a wonderful blessing. So all of those things are good things. I hope this is informative. I hope that you now feel like you understand a little bit more of why L-tyrosine could help you, or if it should be an option for you, and how to explore it more. So I hope you have a wonderful, beautiful weekend and week. We will meet up again next week. And I have enjoyed my time with you today. So thank you again for all of your support of our clinic over here. It is truly a blessing to be able to serve you and our community. And we are loving all the feedback about our no cost membership now. And it is truly filling my cup every day to be able to be a part of keeping this community well, getting it better, and bringing on 2021 with a smile on our face. So I hope you have a wonderful weekend. Bye, guys.